Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, everyone. Dr. Steve Rasner. Welcome to the Lionhearted Dental Podcast. So I got a lot of things to say, and I hope it all comes out okay tonight. Because number one, it is late. It is almost 10 o'clock at night. I worked all day, came home, prepared a lecture presentation that I'm doing in a couple of weeks in Florida. By the way, I'd love to come out to you, including my European colleagues or any of you, if you ever want a live Lionhearted presentation. I've lectured for 23 years, and a lot of it went away with COVID. That's the truth. And there was a time that, that feeling that was so exciting to me, that there were people in my profession that valued my opinion. And that feeling never went away. It's not even a money thing, although I am going to charge you if you hired me. But it's something I really enjoy doing as well as these podcasts. So this is what I want to say first. Tonight's podcast is going to be the type of podcast that I have found when I look back at my research that tends to be the most downloaded podcast of all, and that's questions from the audience. And I think that's because so many people have the same thoughts. I do. But this is the dangerous part of tonight's podcast because I might go off topic and hopefully not lose myself and not get back on. So I had a moment today in my office that I want to share with you. A private moment, meaning I didn't tell any of my staff members what I was feeling or thinking. And here's the thing. Here's the backdrop. You've heard me for the last several months talk about a record-setting year. And it has been. It has not waned. My book is filled. It is backed up, which I don't think is a good thing. Here's my problem. Here's a little tidbit for you too. Those of you that are in your own practice at this stage, those of you in an associateship, when you do get into practice and you do implement Lionhearted principles, you're going to get busy. And when you find you're too booked up, meaning you can't see patients for services that you have to offer for 3 weeks, you need an associate. Now, that's the tricky part, because you don't need a full-time associate. You need somebody that's willing to come in 1 day a week, and that's hard to find. But everything at a high level of success is not a given, is not easy. So I don't want to hear it's too hard, or how could I do that? One of the first slides in every presentation I ever gave basically said this. It said, you don't have to be first in your class. You don't even have to be in the top half. It doesn't matter. As long as you recommit yourself to being a top level elite professional and you're willing to outwork everybody else because you want the end goal so bad. I always just say that, and it's true. So that's when you get an associate. And it's hard, you're right. So if you run your practice really well, if it's a Lionhearted practice, you're going to find a dentist out there that wants to be associated with your kind of practice. Because the opposite is so prevalent. There's so many practices that have been diluted of what they once were. They were once probably inspired and had lofty goals. But a lot of things can take you off that track. Making more money, having multiple associates do a lot of dentistry. Quantity over quality is probably more profitable than what we do in the beginning. Because in the beginning, you don't have it all streamlined and organized. And it will come to that. I promise you, it will. And that's true, but that has been my observation. And I have the second problem that some of you have as well, that I'm not even located in an area where the dentist from Philadelphia, which is 50 miles away, and there's many more clinicians in Philadelphia than in rural South New Jersey. But do they really want to drive the 50 minutes or an hour that it takes? That's always been an issue for me. So yeah, it's hard. It's hard to find, but you don't care if it's hard. So what? Everything's hard. So that's not a reason not to pursue it. So those of you that are in it, it's a wonderful thing. It's a breakthrough, early breakthrough in your career. It is a mistake, unless you don't want growth, to make patients wait 2 and 3 weeks to have a restoration put in. It is. Again, unless you don't aspire to being busy. Same thing with hygiene. Same thing with new patients. By the way, we always made room, and we still do, for new patient visits on any given week. You want to know how to do that, you need to write to me. So, yeah, that's just bad business. I mean, how many times have you, listen to me, all of you listening tonight, you're telling me in the last year that you haven't got a new patient because they couldn't get into their dentist? Of course you have to schedule yourself and your hygiene and be flexible that you will see quality. I said quality. New patients. Michelle, my new patient coordinator that you always hear me allude to, always confronts me when I tell her, we only see 8 quality new patients a week. She says, do you know how many that I screen that never even get in here? And I'm the one that taught Michelle that screen. It's true. We screen out a lot of patients because if a patient's not going to allow us to take a full set of x-rays, we're very, very good at our language and how we present things via the telephone. So we're not saying in a very sterile manner that this is our policy in our office. We will be taking full set of radiographs for you. Dr. Rasner will do a comprehensive examination, which will probably take about an hour. He will be examining the Pankey style of a new patient exam. No, we're very user patient friendly. And Michelle is very, very good. And I hope your Michelle is very good at allowing patients to know, because it is the truth, that they benefit when they seek work of any kind, a broken tooth, a filling, a checkup, if the dentist that they're going to takes a comprehensive approach. But you have to word it carefully, because unfortunately, comprehensive implies expensive to a lot of patients. But not everybody is in the market for that. My big thing in my first 10 years was an appointment today. That's what used to be my marketing thing. And maybe in your first year or two, that's not even a mistake. I'm not sure what I think about it right now. So an appointment today, I would say all these clever things, like a toothache doesn't know what time it is. I would take on emergency patients, of which I don't get many today. I don't get the patient with the blown up face and a pain on a 9.5 on a scale to 10. Because I believe after all these years of branding, the marketing I've used, is that people know what our office is. And it's a office that provides high quality care through a comprehensive look. Does everybody accept that? No. And I've discussed on previous podcasts the red flags that will stop me from putting or treating one crown on a patient that refuses what I recommend. Because some things are indeed flexible and some are off the bargaining table, like soft tissue health for me is off the bargaining table. Periapical lesions that don't look dormant to me. No, I don't have every patient have every root canal redone, or I don't like the fill. No, that doesn't happen. I've told you before, I don't try to replace every tooth in their mouth unless I believe it is causing and contributing to the problem they have or a problem that they will have that they don't know about. Right? Does that make sense to you? So back to where I started this. So everything, my present problem is that we do in our practice based on 40 years of CE by yours truly, some high end and high level, very difficult types of cases. GBR, growing vertical bone in a maxilla, horizontal bone augmentation, a giant crown and bridge case. And so it is very hard to find clinicians that can come in and help me with that. So even though I do have an associate a day a week, I have a couple actually, and they're taking a crown off me and a crown off here that I'm not doing at this time. I don't get any relief in the form of major cases, which I understand is a very nice problem to have. And it's been a while since I've had a quality couple days off, to be fair. But I found myself just thinking how hard this is, these things I do. And I was, by the way, in an easy case. I was. But if I step back at the end of the day and I realized that I prepared 10 teeth for crown and bridge, which I did in one sitting today, which I realize is not record breaking. But I'm sure, like many of you, even when it's a crown and bridge case of multiple units, it is really hard to keep your focus. Are all your preps clean? Have you polished? I know a lot of you do what I do. I polish my preps with brownie points. And I'm looking, are they parallel? And have I missed anything? Do I have the gingival finish line where I want it? Oh, I got bleeding now. I went too far. Oh my God. I mean, it is hard what we do. And I had a moment today. Like, really, the moment takeaway was, I'm glad the holidays are coming up. Because at the level that many of us have reached, that's why I can't imagine how any of you work 5 days a week. And I did do that probably in my first 10 years or less. It's too hard of a profession to stay focused at the level that I'm inspiring you to focus. Everything we do requires high concentration, high focus. I mean, can we just be honest for a second? When you see patients that come in to your practice, there's often root canals that you cannot understand how that was acceptable to the person that did it, or crowns for that matter. Is that not true? Or just about anything. And by the way, I'm sure I have some morbid stories of clinical outcomes of my own that it's hard for 41 years to be on every single day and make sound decisions every day. So don't beat yourself up too bad. But those of us that care at the level that we care about and see these things and don't want to be a part of that, it can become very trying. So you got to give yourself breaks. And that's why I'm a gigantic advocate of adding time to your procedures in 2022. I'm not kidding. I add an hour almost to anything I do. I do. And it's still hard. And I love it because I'm rarely behind. Just that one move. How much you need, Dr. Rasner? In my head, I'm thinking I need an hour. 2 hours. 2 hours? Yeah, 2 hours. 2 hours, for example, for an insert of 6 crowns. That's a pretty good time. It's an example. So that was my moment. I guess I'm sharing it with you because even when you perform and are having a good year, you really have to in dentistry. I can't speak to law or brain surgery. Boy, sometimes I'm really not articulate. How did I get to this point? How did I become a podcast guy and a speaker when I can't even think of the right words? I guess because it's 10 o'clock. But you don't have to edit that, my friend. I didn't say your name, so you don't have to edit it. I'd leave it in there. It makes it more real. So let's get to a couple questions before I blob away. I've already used 17 minutes. I'm going to just take a couple because I didn't mean to go that long. So, questions from the audience. Been listening since the beginning. Love the podcast. I love saying that. But I have a problem. I have a valued staff member that has come in and told me that she didn't have a raise in the last 2 years. And really not in a position. How would you handle that? And that question infuriates me. It does. I'm going to tell you why. Because I don't know how big his staff is. I didn't ask him. But this is for staff members. Listen and hate me. Listen and understand. There was a time, I believe, in many businesses where if you haven't received a raise in X amount of months or years, it was appropriate to say that. It's not appropriate. Not in a Lionhearted practice. It's not appropriate because time doesn't have a lot to do with anything. I hired somebody recently that had over 20 years experience. And this person did a good interview. They looked good, very professional, said all the right things. And the fact that they had that much time in was very impressive to me. But you can be average with very limited knowledge for 20 years. So really, what are you? You're somebody that needs a lot of teaching still. And if you have a good attitude, that's fine. When you go to your boss, I swear to you, this is advice that is priceless. I mean, if you like dentistry, talking to staff right now, if you like dentistry, love dentistry, and you really would like to make more money, then there's about 3 ways to do it. Number 1, increase your productivity. If you're a hygienist, take on other duties in the office. Yeah, my hygienist does the ordering. Besides hygiene, one of my hygienists. Learn how to pour out models, bleaching trays. Take on something that adds productivity. If you're a dental assistant, there's a myriad of places for you to improve, I would think. So you have to exert yourself. So you have to be patient. And the first step is not to go to the boss and say, I haven't had a raise in 2 years. We hear you. Maybe many of your members of your team are in a similar situation. And by the way, every office is different. I don't want to hear about your friend 30 minutes away that's making what she's making. Maybe that boss is at a different stage than your boss is. This isn't an anti-staff's commentary right now. This is trying to help you understand the best way to position yourself. And one way is to increase your skill level. If you're not sure how to do that, then go to your boss and say, look, I was going to come here and ask you for a raise, which I do want. But I want to know what I can do within this office, what I can take on that will make me more productive in your eyes and help me achieve a higher per year compensation. You said that to me, I would be pretty impressed. The second thing is, and this is priceless, become the person in your office that your boss only has to ask one time, and he knows or she knows it will get done. I've said this before, I don't care. The worst thing when you have a big staff is having to go back to the staff after you've asked something that you thought of 4 o'clock in the morning. So you remembered it, you wrote it down on a scribbly pad, or you texted into your phone, and you remembered the next day. You were so relieved. What happened to you when you did that? Your mind relaxed a little bit. That's right. And the opposite staff, team members, happens when the boss has to come back to you and say, hey, did you blah, 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 blah? Did you do this? It happened to me. It happens to me a lot. And I think I have a pretty impressive staff, but it happens, and it's the worst thing they can do to me because it stifles everything else, my brain waves. It stifles my creativity. So don't go to your boss and take the road of you haven't received a bonus in X amount of time. Go to them and say, what can I do? And also at the same breath, starting tomorrow, tell them what I just said, that you'd like to be one of the people in the office that when you need something done, you can count on me. Maybe it's sending out drills for repair. Maybe it's getting new literature in the hygiene room for the staff that needs you to do some research and edit it. Yeah, on your own time, at home. Oh my God, God forbid, right? I know I was going to go here. I'm sorry. It makes me mad. And it makes me mad because it should be symbiotic between you and the boss. I want you to think of your organization as a collective business where you're all in it for the same thing. You hear me? You're all in it to be that place in your community where everybody wants to go. Well, that's not going to happen if you have GV Black, that's the father of dentistry, at the realm, and nobody else is helping GV. We need all of you. We need front desk people. Today, we've had kind of a weird week. You always hear me talk to you about getting paid up front. By the way, that's the next question. I hear you speak, Doc, about getting paid up front. Really? So he said, is that real? How can that be? I'm going to come back to that in a second. Let me say this. How can it be? It's a mindset. It's a mindset that you don't do it because you're afraid to implement that because it seems, well, how can you? You didn't do the work yet. Let me ask you a question. If you're a member of this listening audience, is there anybody out there that's going to take that patient's money and not do the work? In fact, do it as quickly as you possibly can, as well as you can. So where is the risk? When you're paid up front, it's a commitment by a patient to finish the work that was recommended. You don't have to worry about a flood in their basement. That takes priority over the lower right quadrant that you were doing. You don't have to worry about them breaking appointments, in fact, because they want to come to you because they paid you. It's just true. That's the biggest benefit of it. A commitment by the patient to finish the work they need, to not have to worry at the front desk about, hello, Mrs. Jones. This is Shelby calling from Dr. Rasner's office. See, you have an appointment due Thursday. Just reminding you that the second payment of $4,400 will be due that day. And is that okay? Sure. Then you call Wednesday real gently. That was Tuesday for the Thursday appointment. Then on Wednesday, you really gently reapproach that. Did I call you yesterday? Oh, good. We'll see you tomorrow. And I did tell you about the payment already. And then Thursday, would you believe something went wrong and they don't show? You know I'm speaking the truth. That's why we get paid up front. It eliminates the front desk with the awkwardness. Nobody ever has to ask for somebody to bring a payment because you've been paid. I don't know how anybody wouldn't benefit from that. So it's a mindset. That's why it works. We don't think of it as weird. I present a treatment plan. I actually say to the patient, so here's what's going to happen next. Michelle has already met that patient. She's met him on the phone when she scheduled the appointment, and she met them in the office, as you've heard me say, for a face-to-face backup second interview with their significant other. And I say, well, you met Michelle, so here's what's just going to happen. I didn't know what you needed when you arrived today. Now I do, if I do. Sometimes I have to bring them back, like many of you. But if I know the case, I'll say, so here's what's going to happen. Michelle's job is to see if she can fit. Now, this patient didn't call up most of the time asking for a treatment plan. No, they came in with my mouth's a mess, or I broke a tooth on the right. I got multiple missing teeth. I don't like the way my appearance is, whatever it was. And I say what I just said to you. And so Michelle's job is to see if she can fit this in your world financially, comfortably, just like that. And Michelle comes in. And I'm not in the room at that point. I mean, it's the way I've done it for years. It's certainly not unethical. I think it's unethical to start a big case and not know how it's going to end. And it's certainly not about being greedy. It is exactly what I told you. But it takes a team that believes in that. I'm going to make this the last question. And he also asked, what if they changed their mind and you started something? Here's the answer to that. Like, let's say they came in and we did mounted models. We did a wax up. I can't think of a situation right this second where that would be applicable. But people do change their mind. It happened to me today. They came in, they had a full exam, they had a CBCT, and they signed a treatment plan. Had it happen today. And remember when I told you about not making patients wait too long? This patient waited 5 weeks. And I'm working on that. Gabe, if you're listening tonight, I'm working on that. Okay. So I'm trying to get somebody to help me. That's the inside joke. But I usually refund everything back. Maybe not the exam fee or the x-ray, but if there's models taken, I've done it if I had a provisional partial denture already made in the lab as part of the treatment. I look at that the same way, this is the truth, as I look at charging a patient for a broken appointment, which is an awful idea. A broken appointment in your office is just a symptom of a broken system that particular moment. And you have to fix it. It does you no good to punish a patient. It creates incredible bad will. And the amount of people that will say negative things about you because of something negative, unfortunately, is much greater than people that'll say nice things about you. And I think in the long run, it's just best to always make your best effort, your most fair, no matter how bitter you might be, to really try to lean to the other side in favor of the patient and let bygones be bygones. They change their mind. I'm serious. It does happen. And a big practice is getting the kind of numbers you hear me share with you. Damn right it happened. It hasn't happened much this year. Lately, it's been happening. And I think it's because I have patients put out too far. That's part of the problem. But I really mean it when I say to you that I want Michelle to find a way to put this in your life comfortably is the operative word. Who the heck wants to do a beautiful smile makeover or implant case where the patient might be resentful to you because that bill comes every month and they heard you're expensive after you were done? I don't know. You can't please everybody, but it goes a long way towards trying to minimize contentious patients in your community. What's fair is fair. You prepped a quadrant of crowns, you're going to have to prorate that. I don't remember last time that happened. Anyway, I have a bunch of other questions. I'll try to follow it up next week. And I've seen this in a lot of associates. Associate will come in and do a big filling on a patient and then say to me, look, it was a really big filling. I told them next time they're going to need a crown. Oh, really? And you think that's the way you should handle that? We got to talk about that, ladies and gentlemen, because I don't think that's the way you should handle that. I don't. So, hope this helped this week. I hope you have a wonderful holidays. I don't know where I'm at in my podcast, but you mean everything to me. This little job I have in my kitchen at 10-something at night is a big part of my life. Maybe someday I'll look at it and not think that, but I do now. So, trying to root you guys to the highest level of success to which I can push you, and I hope to do that in person next year. Have a great week. See you next week on the Lionhearted.